Yeah, thank you. My name is Benjamin, representing part of the Villgro team and part of the Wellcome Snakebite Innovation Prize opportunity. I will want us to kick this off. We have my colleague, Wilfred, who will just set the tone, and then we'll have the Challenge Works team come in, and also the Villgro team, and also after that we'll have a chance for you, the different participants, to interact. But not going much into that, I will let Wilfred first pick this up, and then we can proceed. Wilfred, you can proceed if you can get us from your side.
Thank you, Benjamin. Confirm if you can hear me.
Yeah.
Great. So first of all, my name is Wilfred Njagi, co-founder CEO at Villgro Africa. Very, very excited about this prize. Most of us, we grew up very, very afraid of snakes. And we've not, for the 10, 12 years I've been in healthcare innovation, I've not come across anyone who is doing a challenge on snake bite and embalming innovation. So this is a unique, one of its kind. So you should feel very, very lucky to be in this very inaugural Snakebite Innovation Prize. I haven't come across anything like this. So it's quite exciting to be among the pioneers of this. And we are looking forward to you as the champions who will be coming up with some solutions to snakebite challenges in the global south. Next slide, if you can go to the next slide, Benjamin. All right, so what do we have in store today? We have 1.5 hours together that will be divided into 3 parts. This is the first, which is this presentation. Then we'll go into a breakout sessions, and then we'll have Q&A. So be on the lookout, make it as interactive. I would urge everyone to try to contribute as much as you can today. So we start with the overview of the prize. We look at the snakebite patient journey. How does it look like in Sub-Saharan Africa? When you're bitten, where do you go to, right? And what are some of the myths and some of the misconceptions around what to do when you get bitten, right? We've all grown with hearing about these myths. When your snake bites you, you need to do 1, 2, 3. But then when you look at the evidence, the scientific evidence, you find that sometimes some of the things we do might actually harm the patient. So today we'll be looking at how do we solve some of those challenges, including where do you access care. So later on, we'll do the breakout session. We have amazing contributors, amazing experts today who are in the field as either practitioners or researchers who will be sharing from a practitioner point of view, from an expert point of view, to put everything in context. And then from there, we look at the next steps. Next slide, Ben. Now, these are our partners. The funding partner, Wellcome Trust, is a strategic sponsor of this prize. And then we have Challenge Works, who are doing the delivery of the program and the overall coordination and design of the challenge. And Villgro Africa, who is the regional implementing partner for Sub-Saharan Africa. Remember, this call is global. So Villgro Africa is only handling Sub-Saharan Africa, but we have other partners handling other parts of the world. Next. So why is today important? One, as I said earlier, there's a lot of misconceptions around snake and snake bites. So today we'll go into real problem setting to define how big is the problem, the severity, and also fully understand the context of the problem. Yeah. Then we'll we will also learn from lived experience. We'll be hearing from one survivor who is on this call, who has survived a snake bite. We'll hear from healthcare practitioners, and we'll get real life experience, right? Then lastly, once you've understand the problem very well, you'll be able now to start shaping better solutions. Today, we'll just focus on problems, And then we'll have another immersion series after 2 weeks that will look at solutions. So today, let's focus on just understanding the problem. If you have any question, today is the day to really dig deeper and get grounded into what is the problem we are facing and why is snake and snake bites still a challenge in this time and era. Thank you. Next slide. So as you can see from my screen there, you see the snake bite is not only a medical problem, it's actually an issue about access. It's about logistics. It's about awareness. It's about screen diagnosis. And lastly, it's a health systems challenge. It's all about a coordination, a healthcare system coordination challenge, right? So it's not just about the bite, but how do you get access? How do you supply the antivenoms? How do you make sure that when you show up at the clinic, there's actually the antivenoms available? And also, how do you get the patient as quickly as possible? And what do you do in the first few seconds of the bite, right? So we'll be going more and more into that. And now I'll hand it back to Barbara from Challenge Works to walk us through the prize and the timelines. Over to you, Barbara.
Thank you, Wilfred. Hi, everyone. Yeah, we're very excited to be starting off with the Wellcome Snakebite Prize. As you all know, it launched on the 17th of June, and the applications will be closing on 16th September, so in about 3 months' time. So we're going to start off with this outreach phase that will last over the next 3 months, in which you'll have access to other webinars such as this ones. The Snake Hacks will be also talking more about that in a second. And then there will be a judging and assessment process over which 15 finalist teams will be selected. Then they will have 10 months over a development period in which they will continue developing their solutions, gathering evidence, and working on their impact. And then there will be another judging period towards the end of 2027 where 4 winners will be selected. They'll receive additional funding, and then they will have 3 years to further develop their solutions, and the prize comes to an end in 2030.
Great, thank you. So Ben, are you the one taking over from here?
That will be me. So I can speak through the challenge and to give us just a better understanding of what problem we have in front of us. So globally, there are about 5 million bites a year. And what that translates to is about 100,000 deaths. And for those that get treatment and are able to survive the bite, some of them, about 400,000, are left with some kind of disability that's life-changing in many, many instances. So part of the goal is to see how this deaths and the injuries can be reduced significantly, with the death rate being reduced by at least 50%, given what we have. Enoch, next slide. And in terms of some of the realities on the ground when it comes to Sub-Saharan Africa, what are some of the things that people have to encounter? And we'll hear a lot of this today when we get to the next segment of this, when we get to hear from the people on the ground and some people that have actually encountered a snake bite. But number one is there's a big challenge in terms of delay in patients actually, or those who've been bitten actually receiving care. Number two is also in terms of sometimes there's first aid practices that are harmful, but are widely practiced, which results sometimes in more aggravated injuries as a result. Another challenge that we see is in terms of logistics, in terms of transport and distance to receiving care. Sometimes the facility that people would be good for very far, or even in terms of getting the antivenom serums to those said facilities. Times the logistics are not quite in place, leading in turn to higher death rates and severe injuries as well. Then there's also another issue of fragmented referral systems. And that's again in terms of how is the community response, which clinics and referral pathways are people and patients following, and are those referral pathways leading to the correct care? Another gap that is there is in terms of diagnostics. And also, how do clinicians have the right tools, for example, to identify that this patient has been bitten by this snake and this is the type of treatment that they would need? So because of that, you find sometimes there's either administration of the wrong antivenom serum, or sometimes it's not even available. Another and big challenge is also in terms of facilities. Are health centers ready to receive people who've been bitten? Are they also ready to administer the correct kind of care? So this gives a snapshot of some of the gaps that exist on the ground, and in the same measure also presents opportunities that innovators in the room today can then create solutions around to alleviate this problem across the continent. And looking at the patient journey, and I think we've covered this in the previous slide, so I won't take too much time. But first, there's that initial point of care, which is someone receiving the first aid that they need immediately when the bite has happened? Number two is also around access and logistics. People who've been bitten, they need to get care quickly, and it needs to be the right kind of care. So are these facilities close to people, and are they equipped in the right ways? That also leads to the next point, which is around assessment and diagnostics. Do people have the right solutions? Do clinicians on the ground, first aid respondents, do they have the right tools to make the correct assessments and issue care as a result? And overall, are those the things that are needed in terms of the antivenoms and other support medication, medtech devices, etc.? Are those available when the patient needs them the most? Yeah, and then in terms of what kind of innovations we're looking for, maybe you can go to the next slide. Yeah. So in terms of what is in scope for this particular call, so one, there's medtech. So if there's anyone who is innovating around diagnostic tools that help clinicians to make the right calls, the right diagnosis, then that is something that is being within scope of this. Two, there's also logistical in terms of rapid of the patient and also of the medicine and antivenom serums that would be required. Then there's also technological in terms of digital solutions, apps, AI-driven solutions that make maybe species identification easier and faster and more accurate. Also, there's solutions in terms of financials. Are there mechanisms to fund access to the care that the patients need, and to fund some of the other elements that we've also talked about? That is also something that is within scope. The other thing is also around healthcare access, ensuring that the right facilities exist and they're well equipped. And the other thing is also around preparedness of the communities to be able to handle such instances. So what is definitely out of scope is development of antivenom from scratch. That is definitely not in scope, but making those available more readily and easily, that is in scope. Primary prevention, that is also outside of scope. Research and data collection that does not particularly tied to a specific solution, that is also out of scope, and also solutions that are around long-term recovery and rehabilitation and solving for mental health illnesses that may have come from a snake bite, that is also out of scope. And then I think I'll hand it back to Barbara for this segment.
Yes, thanks, Roringa. Yeah, so we've designed this prize into two tracks by innovation maturity level, just because we want to ensure that both existing promising solutions are really incentivized to participate in the prize and that they can achieve near-term impact. But at the same time, we want to open the field and the problem to diverse problem solvers that may have a new idea and they may already be working in snakebite, or they may be working in other fields and they can apply their solutions from other fields into snakebite. So these are two tracks. The first one is the launch track, and this one supports new or repurposed ideas to enter the field and test their solutions. And then the growth track, that one strengthens more mature solutions that either have already been tried and tested in snakebite or other fields, and that might need minor redesigns to reach a greater scale and operational integration. Importantly, they both respond to the same challenge statement. They are judged under the same judging criteria and they work under the same price timeline. However, the type of support that we will provide, as well as the financial support, is different between the tracks, and also the level of evidence that they need to provide at each stage of the prize. So as a summary here, the 10 launch finalists will be selected and they'll be receiving £75,000 each. And then 2 launch winners will be selected and they'll receive £750,000 each. From the growth track, 5 growth finalists will be selected and they get £100,000. And then 2 growth winners will be selected and they receive £1,750,000 each. Next slide, please. So in terms of the launch track, so what we're looking at this stage is for early stage concepts that are great ideas and that they're seeking a proof of concept to enter the prize. The other option is for a bit more mature solutions that are already present in other fields, but that need major redesign to be applied for snakebite patients. So this is the target that we're looking for when applications are submitted on the 16th of September. And by then, what we are asking the teams to do is to include that solution ideation and then how their plans will help them reach innovation maturity level 2 by November 2027. There's going to be more information on the prize website and on the innovator handbook by detailing what we mean exactly by this innovation maturity level. So you don't have to worry too much about that right now. And then the idea is that by November 2030, so when the prize comes to a close, that the launch track teams will reach innovation maturity level 3 as a minimum, and that they're ready to deploy their solution and have already gathered some data and evidence of their solution being tested in real-world pilots. So we've already detailed the amount that each team will be getting, but it's important to note that we will be providing an innovator support package that's bespoke to their needs, that also links them with either snakebite experts, technical experts, and others that can help them develop their solutions throughout those 10 months. Then in terms of the growth track, so here by 16 September, what we're looking for is established solutions that are looking to grow within snakebite and more mature concepts from closely related sectors that need minor redesigns to be applied for the snakebite patients. This needs to be at a minimum of innovation maturity level 3 to apply for the prize. So they must have their solutions under development and already have gathered some evidence of how it's going to work. By November 2027, we expect them to reach innovation maturity level 4 as a minimum, so that they're preparing for implementation and commercialization. And by the end of the prize, we expect them to be at innovation maturity level 5, which means that they are already implementing and rolling out the solution and assessing its impact on a much greater scale. In terms of the eligibility criteria, one important thing to note upfront is that individuals cannot enter the prize on their own. They must enter either with their organization or under a host organization. However, we are open to the types of organizations that enter the prize. This can be universities, startups, NGOs, and also very importantly, they can join as a consortia. So a startup can pair with a research institution, an NGO with another NGO, and they just need to select who is going to be the lead applicant and the lead organization from that combination, from that consortium. Teams can submit multiple entries, but there's only one per lead applicant. So let's say that there's a host organization that's working with different teams. They would each need to submit the proposal under one lead applicant that's different in each of those instances. Just a note on conflict of interest that no employees of Wellcome, the Nesta Group, or members of the judging panel can submit an entry to the prize. And for the geographic scope, the solutions must target the high burden geographies. There is a list that you can find on the website of the eligible countries, but if you do have any questions, please let us know. These are mainly countries in Latin America, Sub-Saharan Africa, South Asia, and Southeast Asia, although there are some exceptions. And finally, the entries must be submitted in English. However, we encourage you to submit your entry and use translation if needed. It's important to note that the quality of the English is not going to be evaluated. We care about the content. And therefore, if you do use some tools to translate your proposal, that's fine. So the way that the assessment and judging process will work is that we first have a pool of technical assessors, which are experts that will assess the entries and then offer insights to support the judging panel. Then the judging panel will come together. This is a group of international experts in multiple fields that will look at the solutions and the proposals from different angles, and they will select the finalists. And then in that later judging stage in a year's time, they will also select the winners. It's important to note that they might have a portfolio approach as to how they're selecting the finalists and winners, as we wouldn't want a single type of solution or solutions focused only on one point of the patient's journey to be all selected as finalists and winners. So they will take this into consideration while assessing the entries. And finally, in terms of the judging criteria, you can again find more information on this on the Innovator Handbook and Prize website, but we'll be judging the entries based on 6 criteria. The first one is impact, which means that we're looking for measurable improvements in snakebite patient outcomes and the reach or the scale of the solutions. The second one is innovation and contribution, which really looks for solutions to advance the field beyond the current practice and to bring in some novelty. The third one is implementation and sustainability. So we will ask the proposals to include that pathway and that strategy for long-term sustainability, how it will be adopted in their selected scale, and how the solution will be financially viable in the long run. Understanding of the end user is a fourth one, which means that we want the solutions to be either informed or co-created with the end user so it can be most impactful for them. Team capacity and delivery. So the team has to have either the expertise or plans for including people with the necessary expertise to deliver the solution. This can also include other partnerships and must also include a realistic plan to successfully deliver the solution. And finally, it's safety and ethics. So the teams must demonstrate a commitment to safe, ethical, and responsible implementation. You can see that there are different weights for the launch and the growth track, and these weights might also change for the winner stage.
Thank you. Thank you, Barbara. Thank you, Aringa and Wilfred. Yeah, I think that just sums up like the first part of this, just to be able to present the overview of the prize itself. I don't know from the audience's side if you're able to access the chat icon to probably type any questions you do have, or if you could be able to share any Q&As. Yeah, I think at this point, probably we might have just a minute or two for Q&As, but you can also just leverage the Q&A icon. Maybe from the audience, just confirm from your side if you're able to access that so that we can move to the next phase. Yeah, so as we continue, so as we continue, maybe Enoch, you can just move to the next yeah. So what we just want to do is for us to briefly tie what has been shared in regards to the prize with what type of experiences that have been had out here. So the next conversation will be speaking to this. So we have the privilege to hear from individuals whose work has been shaped by snakebite. So just to also complement the earlier conversation, in addition to the statistics, what we will be doing at this point is getting to hear about realities that have been faced across the different health systems by patients at the community level across Sub-Saharan Africa. So as we get into this session, what I will encourage all of us is to think about three things. So one is where do patients encounter the biggest barriers when we look at the snakebite journey? And then two is why do those barriers continue to exist? And then three is where might innovation make the greatest difference in these different patient journeys. So joining us are individuals who will be sharing various perspectives from the snakebite patient journey. We do have Joseph Kenga, who is a snakebite survivor, and will share his lived experience as he's been navigating that journey. We also do have Caroline Mbangula. She's a clinical officer and a county snakebite program coordinator who closely works with communities and frontline health facilities just to be able to strengthen emergency response. And then thirdly, we do have Kyle Ray, who is a herpetologist and a conservationist. He focuses on prevention, community education, awareness, and fast response. And lastly, we have Dr. Ofwete, who is a public health epidemiologist and also a One Health specialist, focusing on surveillance, diagnostics, and evidence generation. So thank you, Joseph, Caroline, and Kyle, and Dr. Ofwete for being with us today. Maybe just transitioning into the conversation, we can just get to hear from Joseph. And before we begin, probably, Joseph, you can just briefly introduce yourself and tell us your connection with snakebite. Joseph, can you hear me? You can jump in.
Yes, I can hear you. Confirm you hear me?
Yes, we do hear you. Yeah, you can proceed.
Okay. My names are Joseph Kenga from Malindi. I have living with snakebite since 2023 because at that time I was working in Malindi, but I have shambas at my basic home. So that time, I think it was on Monday, that 29 at around 6:45 p.m., whereby I was carrying the maize from the shamba, and that was the last trip. At that time, I was with my wife carrying the luggages of maize from the shamba. We have passed through that point. It's a small bush from the road to the shamba. Before you connect to the main road, there's a small bush, but we have passing that place for 3 good hours. So as we passed by, going the shamba, going to the home, I was, it was that time by 6:45, whereby there is a little dark in such that if there's anything down there, maybe you can't see because of the crossing of the grass. So at that point, when we reached at that bush, my wife told me that this place is not safe at this time, so we can't pass here without lighting any torch, because my wife has a small phone, and those small phones, there is the button you can press so that you can light a torch. So as my wife struggling to pocketing her phone from his pocket, the luggage which I was carrying was too pinching in my head. So that I decided to tell my wife that, let me take a step so that you can light the torch, then you pass on me, you can see what is under there before we pass that bush. So as I making a step so that I can pass my wife, as my wife struggling to light the torch, I had a strong bite, because I was wearing an open shoes. I had a strong bite which was covering the shoes and the fingers, the two fingers of my feet. The bite of the snake, or the mouth of the snake, was so big in such that it has put the shoes and also has also touched my two side fingers of my feet. At that time, the stepping was like I'm leaping down, because the bite was so heavy. It's such that I could just having a step of leaping. So that at that time I was leaping, my wife was asking me, why are you want to fall down? To me, I respond that there is something which I don't know, maybe I have stepped on something, or something has entered in, or something has bite on me. Suddenly, as we are negotiating, or we are translating, we are arguing with my wife, I feel something like pinch in my foot. I decided to bend down so that I can confirm, because to pull out like this, it was so difficult for me. To step again, or to push my leg forward, it's just very, it's not able to go. So that I decided to bend down. I was carrying the luggage. I was lifting my left hand to hold the luggage up there. Then the right hand, I decided to bend so that I can feel, or I can touch, what is this biting on my leg. So as I bend down, I fall on a very big snake, in such that from the ground up to where it has stepped on me, it's just 2 centimeters. I think 2 centimeters. As I touch like that, I realized that this is a snake. I told my wife that I have a snake bite. And my wife told me that, why are you not removing your leg? Just remove your leg so that we can move. I tell that my leg is not moving. My wife started saying that it's not moving. Why? Why is not? Why? And I know that when a snake bites on you, it's just plucking his mouth. Why not that? To me, my mind is running like, how can I pluck my leg from the mouth of the snake? At that time, I also bring my hand down so that I can maybe hold on that tightly, so that I pull my leg there. But at that time, I decided to bend down again so that I can put my hands at the bottom of the snake, this bottom jaw of the snake, because I have a lot of courage, such that my wife was telling me that you can take the luggage to put on that, so that you can put 2 hands to open that mouth of the snake. As I was bending down, I hold the lower jaw of the snake very tightly. in such a way that I was in such a way that when the snake was not so tightly, I could brought them to my house, because the tightness that I was in, so that I can remove my leg, my feet in the mouth of that. As I was pressing, his teeth was in my shoes, so that I was pressing the teeth plucked out. So the snake opened his mouth and I pull out my leg. At that time, when the snake has separate from me, I decide to change another route so that we can move to where we have to go to put the maize. Within 20 minutes as I walking to where I can put my luggage, the whole leg was very heavy, in such that you could uplift it again. You are now dragging. I'm dragging my leg with the luggage on my head. There is the blood which is flowing through my shoes, in such that there is drops of blood as I'm going to home. The time I reached at home, I put up the luggage, then I tightly hold the leg, because there is hotness which is coming from the feet to upwards the leg, so that I hold the leg very tightly. I call for my wife to brought me a rope, so that I can tight the place where, this is the place where the snake has bite on me. So from here up to here, I want to cover or to close it tightly, so that the blood flow, it cannot be flowed, so that as it is flows, it is going to paralyze some places whereby my body will covered by a hotness or the poison of the snake. My wife brought the rope. As I'm tightening the leg, my mom also called for my dad, because my dad is a traditional doctor for the snake bite. As my dad coming, as he was coming that to me, so that he can come and give me the first aid, there is the clothes for my dad. As he was coming, he sent my brother to bring me his coat, so that I can wear. As it's like a first aid. I'm waiting for him to come and give me the first aid. But my dad was not able to give the first aid, because where I was being bited is between the feet down here, the feet, the last and the first the first finger. So it's like here. So here, it not be able for him to reach or to bite. As he was struggling there, he also called also my mother to bring the traditional medicine, the black one, so that he used to cut you around the leg, so that he can put that dust, the black dust. As they doing that, my wife tried to call for the motorcycle, so that can take me to our general hospital, which is in Malindi, and it is very, very long. It's some kilometers from where we stay. As I wait in the
Thank you, thank you, Joseph. Just allow me to interject slightly. I'm just trying to be cautious of time. Yeah, so yeah, thanks for that valuable sharing. We'll come back to it. I just want also to have the other contributors to chime in into this, because it's part of the patient journey. Maybe just let me first have Caroline, just connecting with your story. I just want also Caroline to share with us from her experience how a typical journey. So just in the case of like Joseph, what normally happens for snakebite patients, because it would be good to understand where is time lost. Even the other thing would be probably in terms of health system barriers. What do those look like? So just maybe in a minute or two, Caroline, you can speak to this so that we can connect it to another patient journey. We'll get back to you, Joseph. Thanks.
Thank you, Benjamin, for this opportunity. Yeah, I'm Caroline Mbangula. I'm a clinical officer. I work in the Ministry of Health, the County Ministry of Health of Kitui. I coordinate clinical services and orthopedic trauma, and I also coordinate the snakebite management in Kitui County. I have experience of more than 10 years, but in a snakebite field, I've specialized now for almost now 3 years. About the typical patient's journey, I can say that mostly the bites happen in the rural fields or in our homes. As we all know, most of the snake bites affect the poor and the low socioeconomic people. And you find immediately after the bite, when person is bitten from the rural field and home, the first thing they do is to panic. And you can know when somebody is bitten by a big snake, or maybe has found just a snake just at the bed, the first thing they do is panicking. And when you panic, it means you are shouting, you have a very rapid heart rate, and in this, you find that there is fast spread of the envenomation because of the fear. And the first thing they do from the rural facility, they look for a traditional consultation. And at this time, it's when now they think of cutting. As you can hear our patient, what he's saying, they start cutting because they want to put the black snake. Some will start sucking. You can imagine they start sucking, so you are bitten. But others will just start taking alcohol. They start putting hashes. And so the first thing they look is how they can give a first aid. And in this process, it is when now you find there is a delay. And they do the tonication. They look for the strings, they tonicate because they think that the venom will not spread. But these will bring later problems. And it is after this, when they see now the swelling is increasing, the bitten area is still turning black, now they think an option of now looking for a hospital. And this has taken now time. In this process now taken to a hospital, they have to now to look for transportation. As you know, in Sub-Saharan Africa and mostly in Africa, you find the rural facilities, mostly they don't have good roads. The roads are inaccessible. There are no vehicles, there are no motorbikes. So now they start looking and calling. Maybe they get a motorbike, they start moving. They start looking for an ambulance, maybe look to source for funding. Look, at the time they come to hospital, already it is very late. First, they elated because of the first aid they were trying. Now, again, now they are looking for transport and how the patient can reach the hospital. And in that place, maybe after now coming to the hospital, you find in rural facilities, the nearest facilities, they are the dispensaries, the level 2 hospitals, they are the centers. And you find most of them, they don't stock and snake venom. Also, you find even most of them, they are manned by just one facility, one staff. So at times you may find the hospital is closed. Maybe the officer there has gone to a meeting, has gone to a training. So it is when they reach there, they find the hospital is closed, or the hospital doesn't treat what? And snake bite. So it means there is secondary not referring. And you find there is no this calling of let's wait for us. So this secondary now transferring again, you find maybe the fuel that they had, it was only reaching to that first facility. So it now takes a time. Now, after this, they go to a facility. They find maybe in the first aid facility, the facility that they're supposed to be treated. At times you find maybe even the staff that are there, they don't have the knowledge to treat what? To treat a snake bite, to treat snake bite. So you find there is also a delay in that consultation, also now referring. There is that period, patients are taking time to be treated, and that is the first challenge, most challenge that we get. And you find the first 2 to 6 hours after snake bite is very important, because what happens in the community and what happens in the first aid determines the outcome. So when a delay can also bring death. Any delay in seeking medical can also bring a very permanent complication. Also can also bring a psychosocial problem, depression, because of they have not managed well. So you find these patients' journey, it is very challenging in rural area, especially for snake bite. As we all know, snake bite is a neglected tropical disease, and that is very true. It is very neglected. That's why you find it's not even supported. And in the process, you find so few people who are ready and knowledgeable to treat snake bite management. So we have that delay. So we have delay in the community, we have delay in the transportation, and also the delay in the hospital. At times you can go to a facility, you find it's only one staff, and maybe he has a maternity case. So it means what? They have to wait. So few people still, they don't know that snake bites, it's an emergency. It is still not taken mostly as an emergency, but it's an emergency disease. It's an emergency case that needs to be taken very seriously. So we have a challenge of how it is being taken in facilities. And so when in the facilities, you find there are still a problem in the facilities. You find most of the facility, they may not even have reagents. Most of the facilities, the staffs, they are not able to diagnose antivenom. Patients come to the hospital. Are you able to know what kind of a snake, depending on the presentation? So the staffs, they lack these diagnosing the envenomation. So there is that delay. And so in the process, we may lose patients, we may get bad outcome because of what the patient has gone. And because of these delays in the community, we may get complications, because if patients are tourniqueted, when it comes to the hospital, at times patients they undergo the amputation. Why? Because they were given a lot of tourniquetion. Also during the transport, we need patients to be mobilized, but now also the means of transport for these patients from the community to the hospital, it may delay. And this delay, or it may not be the right position to do the referral, to do the transportation. And in the process, patients may lose their parts of the organs of the body. Patients may also die because of the transport. We've seen also patients after bite, others try now to kill even the snake, and in the process, somebody else is beaten. Last week, I had a patient whom had beaten and while they were sleeping with the mother. And when the mother was trying also to pick the 6 months baby who had beaten, he was bit by the red spitting at the eyes. So you find these are two victims that have been affected. And also you find that in the community, there are still that believes that like this is witchcraft. And so in the process, they delay because they really want to go and look for a traditional, because they think it is a witch. And in the process, there is this delay. So we have these delays of incisions. When patients get bitten by these snakes, they do incision. In the process, they infect the bitten area with infections. So they increase also now the expense, because when you're bitten by snake bites, at times we don't need to give you antibiotics, but because now you are incensed by maybe a razor blade, by a cat, in the process now you get an infection. So we need now, the treatment now increases. So we have this problem. Again now, when patients come to the hospital, you find even now the management, it is very expensive. We've seen in areas, and I've had meeting with some staffs, and say they reduce the number of doses because they know this patient will not afford. So you find also during the management in the hospital, patients don't get the right management because of what? Because sometimes you are not able to afford the right thing. So you are given the low doses because you cannot afford the normal doses of the snake venom and the treatment and the management that is needed. So we have that delay, and the delay now becomes even the poor outcomes. Then where do patients lose mostly? You find now that is these the ELA consultation, we have the transport delay, the financial sourcing, and also now the secondary referring, whereby you find one facility is not able to treat you, is not able to manage you, so you are being transferred now to another facilities. And at times you find even patients may come to the hospital and they tell me they have passed more than four facilities. You've gone to a private hospital, and then maybe now in the private hospital, they don't want you just to come. They have to treat you. They give you something before they refer you so that they may get some money from you. So you find all these patients, they pass a lot of trauma for them to get the right management. That is the problem that we have, and patients suffer.
Yeah, thanks, Caroline. And that's an interesting perspective you bring. Very, very, very curious to see how that conversation continues in the breakout rooms. Maybe just allow us to have Kyle come in, because I think hearing from this, it's clear that to do with community behaviors and emergency response plays a part. So prevention and awareness is definitely critical. Maybe Kyle, you could also just wade into the conversation and maybe just highlight maybe what should innovators understand before they try to develop prevention or fast response solutions.
Hello everyone, my name is Kyle. Thank you for giving us this opportunity. I think Caroline touched on quite a bit there. Your big problem you have is traditional beliefs and sort of myths which have been passed on. So you find a lot of snakebite victims will rush to your witch doctor, traditional healer, or muganga, whatever you want to call him. And that's their sort of first point of call. This delays a lot of time for them to get to a medical facility. Again, with the traditional beliefs, the use of black stones, a lot of herbs, cow dungs, goat dungs, oils, which are rubbed into these bite sites, incisions which are made, and having this stuff sort of rubbed in causes huge infections. And again, as we say, tourniquets is one of our biggest problems. Everyone applies a tourniquet. And the biggest problem here is people don't know what snake bit them. We have a good amount of snakes in Kenya, about 144 different species. And of that, there's only about 13 which are of medical concerns. So people are getting bitten, for example, by a harmless house snake. They apply a tourniquet to that limb. It takes them time to get to a medical facility, as Caroline said, because of transport, funds, all of that. And by the time they get there, that limb is dead. And it has to be amputated. And that is being amputated not because of the snake, but because of the first aid that has been done. So a lot of work on sensitizing communities on what snakes they get in their area, what to do if they come across them, and most importantly, what to do if you get bitten. The first aid for snakebite is very simple, and your most important thing is to try to get to a medical facility. A big problem with snakebite is it is expensive to treat someone. A vial of antivenom goes for about $80, $70, so about 7,000 shillings for one vial. One vial isn't nearly enough to treat anyone, and the problem is most of these clinics, hospitals, that's what they'll have on standby is one vial of antivenom. When a good starting dose is about 4 vials, you can have snake bites taking anywhere from 20 to 40 vials of antivenom. So it becomes very costly on someone who's bitten. They end up becoming a burden on the family. And the other thing which we really need to think about is the mental trauma these snake bites bring to people. Seeing your limbs sort of rotting, doctors cutting flesh off without any anesthetic. You've used all your money, you've sold land, you've sold cattle, you've sold jewelry to try and cover medical bills. And a lot of people go through a lot of mental trauma after snake bites. As Caroline said, snake bite affects the poor. I always say the voiceless community. If snakes were biting our sort of politicians, rich businessmen, tourism, partners or tourists coming through, it might get a lot more light, and people might take it a lot more serious. But starting in the communities, this is where our focus is, educating them on their snakes, how to live amongst snakes, because we need to understand that these animals were there well before us, and they are very important in our ecosystem, keeping a balance in that. So yeah, from me, that's it from now, and I'm looking forward to the breakout session.
Thank you, Kyle. Yeah, yeah, I think it's very clear, as you say, even when care reaches patients, I think there's still challenge along that path, and I'd want to have us connect that lastly, just before we transition with to the breakouts with Dr. Ofwete. So, Dr. Ofwete, maybe briefly, you could just share with us when we look at the snakebite journey itself again. Where or what are some of the biggest evidence or decision gaps that affect snakebite management today?
Yeah, thank you so much, Benjamin, and thanks to the previous speakers. I think a lot has been said with regards to snakebite challenges, and the points are cutting across cutting. So that's why you could hear from Joseph, Caroline, and Kyle. The points are repeating themselves. So I'll just emphasize on what has been said, but most importantly, from a systemic lens, on the challenges of snakebite. First and foremost, my name is Robert Ofwete. I work with AMREF Health Africa in Kenya as a technical advisor for neglected tropical diseases, where snakebite has been listed by the WHO. So if you look at the biggest barriers, as you did mention, I mean, health-seeking behavior has come out strongly. You see, snakebite is defined as a cause and a consequence of poverty. And as Ray has rightly put it, it affects the impoverished communities. And if you look at the age cohorts that are mostly affected by snakebite, these are the economically productive. Data shows around 10 to 40 years old. So a life lost around that age is actually tied to the disadvantages, is tied to the economy. And so the time wasted is also significant, from the community to the facility referrals from lower cadre facilities, or rather lower level facilities upwards. The referral system is also a challenge, and also downwards back to the community in terms of now management in cases of amputation and what have you. And all these aspects are critical, considering that it's a paracute or an acute event that requires dire intervention. But most importantly is why are there these delays in time? The myths surrounding snakebite, the low awareness in the community surrounding snakebite. You could hear a story from Joseph. Those are important points that are affecting snakebite in terms of health-seeking behavior. But also systemically, or rather with regards to the systems, is that these patients at the last mile facilities, they rarely find what they're looking for in terms of management, in terms of antivenom. So next time when a snakebite event occurs, they will most probably seek traditional healers, because even if they go to their facility, there might not be antivenom, or the care might not be up to what the expectation is. And so that means even at the facility, we have a role to play with regards to skill set. We have a role to play with regards to commodity and supply chain stocks. We have a role to play with regards to first aid, and we have a role to play with regards to surveillance. But the barriers exist mainly because, if I summarize, of the neglect in terms of funding, neglect in terms of skill set, neglect in terms of surrounding neglect, basically. So snakebite is lowly funded, as they rightly put it during the introduction. This is the first challenge on snakebite. I mean, we can already see that from a global lens, and even at a country level, the amount of money that is actually pumped by the ministry into snakebite in terms of management, prevention, or rather first aid and commodities is actually less. The poverty also exacerbates the situation in terms of why the problem exists. But then from the MOH perspective, or the ministry perspective across African countries, is actually the weak surveillance structures. You reported that 5.4 million is the estimated annual burden, but it has strongly been reported that this is an underreporting. Why? Not everyone gets to the facility, and even those who get to the facility, not everyone is reported. And even so, we are relying on, we are more reactive than proactive. So we are relying on passive surveillance. And so we are not at the community, we are not active in the community to actually equip our community healthcare workers with the skill set that are required to conduct first aid and report the referrals to the facility. So we don't know the actual numbers, and surveys tell us that actually the actual numbers are actually more than what the burden estimates. What also exacerbates the barriers is the complexity that comes with snakebite. You know, for malaria, for other diseases, the causative agent will be common in terms of, we know it's anaplasma. We know it's a specific causative agent, but then when it comes to snakebite, it cuts across different species of snakes that actually group based on syndromes. But then even so, identifying the snake is a problem at the community level and at the facility level. And even so, the kind of antivenom to be administered is a problem. And we say in Sub-Saharan Africa, we are using antivenom from other parts of the world that are not effective, or rather fully effective against local snakes of medical importance. And even with the clinicians, they are not equipped with the skill set to administer antivenom, or actually identify reactions, whether it's due to the antivenom or due to the venom itself. So we are seeing a lot of issues surrounding snakebite. So the innovation needs, in terms of innovation that is required, needs to look at wholesomely at the patient level, infrastructure level, the facility level where you have infrastructure and healthcare worker, and largely at the systemic level. So that is surveillance in terms of cases, and even the snakes themselves, ID, and promptly social protection to be able to promote access to care, and also continuous education, just knowledge retention in light of the challenges that we face in terms of high transition rates of healthcare workers, retention rates. So knowledge retention at the facility level is also important. Thanks, and back to you, Benjamin. Thank you.
Okay, awesome. Thanks, Dr. Ofwete. Yeah, so in the interest of time, I'll just want us to transition to the next phase, which is the breakout. But before going to that, just again, much appreciation to all the contributors, Joseph, Caroline, Kyle, and Dr. Ofwete. I think it's very clear that this is something that is just more than a medical emergency, and it's very clear that it's sort of shaped through a journey, all through from awareness, from the first response, the referral systems, diagnosis, treatment, the health system preparedness, because from the conversation we are hearing here, everyone has spoken, has touched on that. We have just exactly 20 minutes remaining to the end of this. So what we'll do is we'll get into 3 breakout rooms, and what will be happening in these 3 breakout rooms is for us to be able to interact more, simply because as we are on this as we are on this call, we definitely have different interests in terms of the different patient journeys we feel that we could be able to contribute to. So let's shift the conversation there. Mainly for today, we are focusing on how the problem is framing and is shaping up. And for you, as you get into those breakouts, the thing is to be able to have discussions around that, because get into these rooms, get to explore what are one or two priority challenges that we see across cutting. And then, of course, from that, conversations will start to come out in terms of what are some of the priority solutions that are the priority opportunities that could be looked at from an innovation point of view. And also try and think about what is that one important question that innovators should continue exploring. So as we get into that, maybe from the back end, from our team, you can just initiate or begin initiating the breakout rooms. We will have the experts who have spoken in each of the room and also the Villgro team. So with that, we'll be able to guide on how to proceed.
Great. Yeah, do we have everyone back? Ben, are we all here? We were cut in the middle of a discussion that was getting very exciting. So I hope the same happened to all of you.
Sorry, I can imagine. Yeah.
Yeah.
I think
But the
there's
good
a
thing is,
transition.
yes. I'm gonna say the good thing is that we can follow up those conversations. This was the trigger, but we're happy to facilitate introductions if you guys wanna continue with those conversations. Yeah. Back to you, Ben.
Yeah, thanks, Wilfred. I'm just trying to confirm if we have majority of everyone back. Okay. Yeah, so in the interest of time, what I think we will get to do is just get into the next steps, which is to do with the wrapping this up. So, so part of today's conversation was just around us being able to frame the problem and starting to see what is happening in the different four snakebite patient journeys. The interesting thing about this is at each of these touch points, we can contribute in one way or another. So our next session, of course, will now be speaking into the framing of solutions. And even before we then get to that, there are points of engagement that we will continue to have. I'm just trying to get a hold of the presentation we did have. But yeah, one of the key things around this is us seeing how is it that we could be able to explore teaming arrangements. For example, for one of the breakout rooms I've been in, it's very clear that there's an interest in the same. So for those who've not been able to exchange the conversations on the chat, what you can be able to do is just get to follow that up. I think what we could be able to do is also, you could also be able just to reach out to us via email. I will just paste on the chat the emails that you can be able to. Awesome, I see that has been written. Yeah, so you can write to the Snakebite team if you are interested in a certain partner that you've interacted with today. We can pick that up from the back end. Yeah, and even also as you interact with the social media posts, you could also be able to raise the same. Yeah, so how it looks like from here, of course, is continuing to do the registrations and being on the lookout for the next immersion series. Just to mention, in the month of August, on the 10th and 11th, we will have a Snake Hack event, which is basically a 2-day event that will take a hybrid format. And in this event, we will be supporting you just to be able to frame and strengthen your applications. The venue of the same will be communicated, and also the online links to access for the hybrid attendees will be shared. But allow me to leave this here for now. once again to thank all the participants, the contributors who have joined us today. And also thanks to the Wellcome team and also Challenge Works team, and also the Villgro team for making this a success. Yeah, so we can end it there. Thanks everyone, and have a good rest of your day.
Thanks everyone. Thank you, Ben.
Thank you.